Nigeria's regular healthcare priorities were disorganized and reshaped by the current coronavirus pandemic that has hit the country last year. This has complicated treatment of other ailments. As correspondent Tesima Kende reports, the pandemic has worsened the country's fight against tuberculosis.
For most of last year, 47-year-old Garba Ibrahim suffered from tuberculosis. He couldn't get treatment at hospitals because most hospitals were overwhelmed attending to COVID-19 patients. Eventually, he found a hospital run by the NGO, Faith Alive, who took him in.
I had checked about 3 hospitals for treatment, but they didn't give me attention. I was fortunate to identify this place, and they considered my situation. It was during the lockdown. All attention was about COVID-19, so we who had TB were not considered at all.
While Garba found help, others haven't been so lucky. The National Tuberculosis and Leprosy Control Program says about 60% of cases went unnoticed and untreated last year, with 18 Nigerians now dying every hour from the disease. New cases have also hit a record, 47 every hour, 7 of which are children.
Currently, there's a rise in our tuberculosis cases for 2 reasons. When you see patients who cough, automatically you assume they are COVID patients. If you see patients that sneeze, automatically you assume they are COVID patients. So there's stigma towards COVID, forgetting that the major killer disease, TB, is still with us.
Experts say health workers need to pay more attention to tuberculosis patients and adopt better ways of identifying the diseases which share similar symptoms.
And it's important that we look at this together so that people don't die and the menace don't keep increasing and increasing because we are looking away from what we have at hand.
The World Health Organization says Nigeria is far from achieving its 2025 national target of halving TB cases and slashing mortality by 75%. But local authorities say they are doing their best to hit it. The Nigerian government has promised to prioritize detection, diagnosis and treatment of tuberculosis across the country. The main focus will be teaching people, especially those in rural areas, about the need to seek medical care early. And with such measures in place, more people with symptoms of TB could get diagnosed and treated in time without having to go through the harrowing experiences of Garba.